Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, President Rodrigo Duterte tells the public not to despair over the COVID-19 pandemic, assuring Filipinos that the country can survive despite the alarming increase in COVID-19 cases. The country records the highest single-day rise in COVID-19 cases since August 14, a year after Metro Manila was placed on lockdown. And as new cases mount, more COVID-19 patients are also in need of critical care. How are Metro Manila hospitals keeping up? Private Hospitals Association of the Philippines President Dr. Jose de Grano, East Avenue Medical Center Chief Dr. Alfonso Nuñez, and Lung Center Spokesperson Dr. Norberto Francisco join us live. President Rodrigo Duterte addresses the state of the country 1 year since the Philippines was placed on lockdown. In a speech Monday night, Duterte tells the public not to despair over the pandemic. He also assures poor Filipinos that they will get their shots after healthcare workers amid the rising cases of COVID-19. Here's the president in his own words.
Do not despair. Kaya natin ito, COVID na ito. Maliit na bagay ito sa buhay natin. Marami tayong dinaanan mas grabe, mas mahirap, mas na magluluha kayo. Saka, I know, lahat kayo, lalo na mga kababayan ko nandyan sa Spokesperson area, lahat kayo, huwag kayong matakot at hindi ko kayo iwanan.
It's like a replay for Metro Manila's hospitals as the recent spike in COVID-19 cases push them to their limit. Some major hospitals have already declared their intensive care units at full capacity. The country recorded the highest single-day rise in coronavirus cases since August 14. The Health Department logged 5,404 new cases of COVID-19 on Monday. This is higher than Saturday's 5,000 cases. So let's go straight to the source of the story. We have Private Hospitals Association of the Philippines President Dr. Jose de Grano. Dr. de Grano, good morning to you and welcome to the source.
Good morning.
Okay, I think...
Yes. Good morning, Ma'am Pinky.
Opo, Dr. de Grano, nag-freeze ata ang inyong video. So I will continue on with our conversation. Okay. Dr. de Grano, I just want to start with this para we're clear on this. Ilan ho bang hospitals ang bahagi ng PHAP?
Previously, we have around 700 plus, 746 members, the Private Hospitals Association. After the pandemic, it went down to around 500 plus only.
Okay, so that's still a lot of hospitals under part of PHAP. Can you please tell us overall, sa inyo na po manggaling, ano ho ba ang situation and what are your member hospitals telling you?
Well, actually, right now, it's still manageable. No? However, there are a lot of our member hospitals who are complaining, because of there are three problems in the hospital right now. First is funding. Because of the pandemic, bumagsak yung income ng hospitals because bumaba ang census. You know naman that private hospitals rely mainly on our admissions. And since the pandemic, it went down to at least around 50% of our previous admissions. And then, of course, number two is staffing. Aside from the funding problem, it's the PhilHealth problem. There seems to be a delay in the reimbursement of our PhilHealth claims and and supposedly the payment for the hospitals. And number two, of course, is the staff requirements. Right now, if you will know, there are a lot of nurses going abroad. Also, the government is competing with private hospitals. They are trying to get, of course, they are attracting the private hospitals nurses because they are offering higher, of course, higher salaries than the private hospitals. And number three, of course, is our problem with vaccination. Not all of our private hospitals, healthcare workers have received their vaccines yet.
So let's talk about that, though. If you have funding is a problem, the issue on PhilHealth, payments being delayed, staffing, and the vaccination program still not being rolled out completely among healthcare workers, how are the hospitals coping? Because I just want to get to this, Doc. First of all, the cases are rising. 5,400 po kahapon. Marami pong ospital na nagsasabing full capacity na po sila. Yung inyong mga member hospitals, they're still saying manageable pa rin po yung sitwasyon?
So far, if you will note the distribution all over the country, it's only around 40 to 45% occupancy. However, in some areas like National Capital Region, Cebu, and probably the Cordillera Administrative Region, they have more or less critical situation already.
Yeah, I think I heard Dr. Ong say ICU beds are, if I'm not mistaken, at 65%. So, okay, manageable. But if we look at the cases, ganito po, Dr. Grano, if the cases continue to be at this level, yung pong nasa 5,000 tayo, even let's bring it a little lower to 4,000. I heard an interview of yours last week, I think it was Friday, and you said that if this trend continues, in 4 weeks, ma-overwhelm na ho yung hospitals. Are you going to amend this? That are you still looking at 4 weeks now that we're looking at 5,000 cases a day?
Most probably, it will be coming earlier, less than 4 weeks, if the trend continues. Hopefully, it will not. Sayang kawawa naman ng mga hospitals at mga patients. But then what we can only do is, of course, refer the overflow of the patients to other hospitals.
Yes, that's true. What about, ang problema ho kasi, di ba, Dr. De Grano, pinag-uusapan po natin yung mga kama sa mga hospitals. But I think we need to underscore the importance of staffing. You already talked about nurses, of course, wanting to leave, going abroad for greener pasture. How is the staffing now, 1 year after the lockdown, and then the cases again rising? Nagkakaroon na ho ba ng hiling mula sa mga healthcare workers for a possible timeout? Ganun ho ba? Dumarating ho ba doon?
Right now, because we already have an experience and we can manage the patients very well. So wala pang ganon na naririnig kami from our healthcare workers na we want to take a rest, because right now at the present time we're more needed than ever. So we will continue to serve as long as we can, and we will continue to admit patients as long as we will be able to do so. Kahit siguro kulang yung aming nurses, but then up to a certain point lang, of course. Siyempre, if we can only manage 10 beds, then we'll have to manage only 10 beds and refer the rest to the other hospitals.
But how are you seeing the trend now? 5,000, 4,000, over 3,000 beginning March 4. Ano ho yung numerong nakikita ninyo na posibleng talagang nakakatakot na dahil hindi na kaya ng private hospitals, yung members ng Private Hospitals Association of the Philippines?
Actually, it's really alarming because when the hospitals were full sometime in August, the average then was around 4,000 plus only. And for a week, it went down to around 20 plus thousand or 24,000. If we reach that number of patients, then we will be probably reaching the full capacity of the hospitals, especially in urban areas. Of course, in other areas, medyo mag-relax pa sila. It's less than 40% occupancy.
Yeah, yung 40% po sinasabi niyo, that's not NCR, no, Dr. De Grano? Just to be clear about that.
No. Yes. It's not NCR.
Kasi,
In NCR, it's still above. Yes.
what were you saying, sir, in NCR kasi?
It's more, a lot of hospitals, at least 6 I know, are already in the critical level of occupancy. And so averaging probably around 60% of occupancy in the whole NCR.
Maybe even more. Dr. Grano, I heard nga Dr. Ong ata kanina, but I need to verify this again. I think she said 65%. But could you identify these 6 hospitals na sinasabi niyong critical na?
Well, yung iba naman actually, they were already mentioning it, like St. Luke's Global. Sometime, I think the Makati Medical Center also, another hospital, the Quezon City General Hospital, some other private hospitals, which I'm sorry, I cannot name them.
Yeah. But when you mentioned St. Luke's Global and Quezon City, that's part of PHAP, sir, ang St. Luke's, no?
Yes po.
Okay. Okay, Dr. De Grano of the Philippine Hospitals Association of the Philippines. Sir, thank you so much for this interview. And coming up, we get an update from the East Avenue Medical Center. The hospital's chief, Dr. Alfonso Nuñez, joins us live. We'll be right back. You're watching The Source on CNN Philippines. Our guest today, East Avenue Medical Center Chief, Dr. Alfonso Cito Nuñez. Dr. Nuñez, welcome to The Source, sir. Sir, East Avenue, kamusta po ang sitwasyon ngayon?
Sa ngayon, yung aming COVID dedicated beds, we are now utilizing 77% of our COVID utilization beds. And we saw this number increase starting from the second half of February. During that time kasi mga nasa 60% kaming utilization for COVID beds. But somehow, slowly nag-increase ito and it went up to around 70% in the early days of March. And it went further up to 77% and it's still climbing as far as we are concerned.
Let's talk about absolute numbers, Dr. Nuñez. Pag sinabi niyo hong 77% ang COVID beds, madami pa akong tanong dito, ilan ho ba yung COVID beds at ilan ho ba yung 77%?
We have actually dedicated 250 beds for our COVID patients. And we have actually established a separate building for all the COVID patients to be managed. And we have actually made this building a autonomous building, at least 80%. All the COVID activities can be done in this area. Meron na siyang sariling emergency room.
Opo. Opo.
Yes.
So, 250 beds, mas madali ho kasi intindihin yun eh. 77% po okupado na. That's about 192 beds. Ibig sabihin, meron pa po kayong 58 beds na natitira as of now. My next question, Dr. Nuñez, is, ito ho bang 192 beds na okupado, ano ho ba to? Moderate, severe, at critical? Because my understanding is the COVID referral hospitals really only take in about what? Take in the severe and critical? Ano ho yung classification nung inyong mga pasyente na tinatanggap dyan?
Well, when I say or when I mention COVID patients, ito ay tatlong klase. They are confirmed, suspects, and probable. Majority ng mga pasyente namin ay probable and suspects because these are patients that they not only have symptoms of COVID, but they have other problems like cancer patients sila, stroke patients that require dialysis or blood transfusion. At nagkataon lang na meron silang mga signs and symptoms of COVID. So dito namin sila minamanage sa building na ito.
I see. So ano po yun? Confirmed and probable. That's right, no, Dr. Nuñez?
Yes, we are managing confirmed and probable also.
Okay. Pero yung 192 na okupadong kama, that includes confirmed, probable, and suspect.
Suspect.
Okay,
Yes,
sa tatlo po yun. Okay.
Opo.
Yung ICU ninyo, kasama na ho ba doon yung 250 bed capacity? Or is the ICU a different department or a different set of beds that you have?
Doon sa 250 beds na yon, we actually incorporated yung ICU beds namin. Initially, 15 beds yon allotted for ICU, but we increased this to around 45 beds right now. And we already made plans to construct additional 15 ICU beds in that same building.
I see. So when the hospitals say we have 250 beds, that includes everything. Ganun ho ba yun, yung tinatawag na ward, isolation beds, at ICU? Ganun ho ba yung to understand the situation?
Yes. Nung na-establish namin ito, ang vision namin is to make this an autonomous clinical area where we can safely and efficiently manage COVID-19 patients.
I see.
Meron siyang sariling emergency room, meron siyang sariling dialysis area, ICU, meron siyang sariling operating room and delivery room. And right now we are constructing the radiology area and imaging area for a CT scan, ultrasound, and the standard X-ray machine for these patients.
Yeah.
Nakaset up na rin dito sa amin ang critical units namin and critical equipment. Like we have the high flow oxygen machine, the ventilators, and other life-saving equipment like the defibrillators. So it's really an autonomous area, at ito yung isa sa mga strategic objectives namin, so that the main hospital can continue at a certain level to manage and service non-COVID patients.
And at least siguro yung pangamba ng tao mapapawi kahit papano dahil nga parang separate, independent, autonomous itong inyong COVID patient. So that includes everything. Right now, Dr. Nuñez, are you still accepting patients who may want to go to the hospital because they feel they could possibly be COVID positive?
We have no choice but to accept, but we have to make it clear to the patients who want to access the hospital that we are really at a level that is, shall we say, at a red level. And it would mean that it's a little bit congested at the emergency room, and there is a little waiting time for them to be admitted in the regular beds and regular rooms, both for the COVID and the non-COVID patients.
Doctor, cite me an example. If someone were to come now, so alam po natin yung sitwasyon na posibleng COVID suspect. Sabi mo nga, there's a bit of congestion, there might be a wait. If someone were to come now, ano hong pagdadaanan ng pasyenteng yon?
The question, Ma'am Pinky, is anong pagdadaanan ng pasyente?
Sabi niyo congested yung ER. So gaano ho kaya katagal ang paghihintay? Gaano ho katagal sabihin natin lalabas ang resulta kung COVID positive? At gaano ho kaya katagal bago siya makakuha ng kama?
Well, yung mga COVID patients namin, they go through a triage, and the triage officer determines non-COVID and COVID patient goes through a triage system, and the triage officer determines if the patient is set for the COVID ER or the non-COVID ER based on the signs and symptoms and complaint of the patient. Now, once na siya ay na-determine at may signs and symptoms of COVID, dadalhin siya diretso sa emergency room dedicated for COVID patients.
Okay.
And there, the patient should have been managed and disposed of, meaning to say, kung kailangan to i-admit or whatever kailangan na gawin within the hour or two. Of course, within this time also, a swab test is to be done. And the swab test usually sa aming system at its very best, labas na yung results in 12 hours.
Very good.
And that is the time na i-determine namin kung the patient will continue with the COVID management or can be safely transferred to the non-COVID wards or non-COVID management area.
How would you describe the situation right now at East Avenue regarding your COVID hospital bed? Sabi niyo nga, did you use the word red, no? You did, is that critical? Ganun ho ba yun? Nasa critical level na ho ba kayo?
I'm sorry, Ma'am Pinky, I didn't get the last statement.
Yes, Dr. Nuñez, I was saying kanina ginamit niyo po yung salitang parang nasa red kayo, parang red alert. Parang ganun po eh. Anong ibig sabihin? Ano yung sitwasyon ngayon? Are you on manageable, critical level?
Well, ganito, yung aming mga critical beds are at 95% occupancy. And that means we have to develop strategies to add more critical beds so we can address the critical and severe cases of COVID-19. We want to be one step ahead of everything. Ito yung natutunan namin last year. And this kept us going and kept us working. But of course, there is a limit to everything. As much as possible, we want to be one step ahead. And yun nga, the 95% is at a red level, and we are making strategies to increase our bed capacity as far as severe and critical cases are concerned.
Just a quick last question, sir. So 95%, ilang kama na lang ho ang naiiwan para dun sa critical level?
According to my data here, meron na lang mga 4 or 5 beds na lang ang available.
For critical patients, okay. East Avenue Medical Center Chief Dr. Cito Nuñez. Sir, Doc, I hope, as you mentioned, no, you're being very proactive about this. 4 beds is a very small number. And we wish you luck, sir, because marami pa ho sigurong pasyenteng pupunta sa inyong mga ER at stay safe. Maraming salamat po sa inyo.
Thank you and good morning then.
Good morning. And we will check another hospital when we return. Pupunta tayo sa Lung Center. The spokesperson, Dr. Norberto Francisco, joins us live. Please stay tuned. You're watching The Source on CNN Philippines. Our guest today, Lung Center spokesperson, Dr. Norberto Francisco. Dr. Francisco, good morning to you. Can you please tell us the situation in Lung Center right now with regards to COVID patients?
Yes, good morning, Pinky, and good morning to all our listeners. Like the previous speakers you've had regarding the hospital occupancy, we are increasing rapidly over the past 10 days, I would say. Lung Center has an operational capacity of around 200 beds. And just to give you an idea for reference, during the peak of the COVID in March and August last year, we dedicated around 160 beds for COVID. This would roughly translate to about 75% of the hospital capacity. And during the lean months of December and January, we were able to bring that down to around 35% or even 30% of the hospital capacity. And yet, despite that 30%, the occupancy rate was only about 30% also. So it's less than half of half.
Yeah.
And then slowly over the past few weeks, we've seen the occupancy rate to rise again from 30 to 40 to 60%. That's why over the weekend, we decided to open a new wing for COVID again.
So, yung new wing nyo po, ilan pong, in total, how many beds do you have for COVID patients?
Right now, we have 105 beds. During the peak of last year, we had 160.
Right.
More or less, because on a day-to-day basis, sometimes a bed would break down or we would have a new supply. So they would vary by a few on a day-to-day
So
basis.
if you have 105 beds now, Dr. Francisco, how much of that is occupied?
I'm sorry, Pinky.
How
could you
much of
repeat that
the
again, please?
105 beds now are occupied?
Yes. 85 of them, or 80%.
Okay, 80%. So,
Yes.
meron na lang po kayong 30 beds. And this is for every...
Imayin pa natin, Pinky.
Sige po.
Out of that 105 beds, we have 56 beds which are capable of handling ICU cases, critical care beds. Because if you will recall, Lung Center is a referral center for moderate,
Right.
severe, and critical cases.
Opo.
More of the severe and the critical cases. So of our critical care beds, we are 84% occupied. That's 47 out of 56 beds. Yung isolation rooms, these are the big rooms we used to have, the suite rooms. We used to put just one COVID patient in there for purposes of isolating them. But we cannot do that now. For as long as they're all confirmed positive cases, we now do cohorting.
Pwede
we
na magsama.
converted it into a ward
Opo.
which could accommodate 2 or 3 beds just
Yeah.
to be able to take in more patients. So our isolation rooms, yung mga isahan pa rin, 100% occupied na yan. Kasi kukonti na lang yung mga rooms na yun eh. Most of the rooms we converted to a ward room so that we could accommodate more patients. And we have 24 out of 35 occupied, or 70%.
Okay, and how would you describe the situation at Lung Center right now?
I'm sorry?
How would you describe the situation? Dumadami ho ba ang nagpapatingin at pumupunta sa mga ER? Dahil ang taas po nung case kahapon, 5,400, sir.
Yes, we're trying our best. Our spirits are still high. We've seen worse cases last year, and we have just reached a little over half of what our worst case scenario was last year. But of course, we don't want to make it reach that point again. Ang hirap eh.
Opo.
Nung panahon kasagsagan last year. And we're appealing to the public also to please take care and exert extra effort. Maybe double the efforts. I don't want to call it a minimum health standard.
Maximum.
I want a little more precaution.
Call it maximum, Dr. Francisco. Ayan na po, that's already an appeal from Dr. Norberto Francisco for all of us to take extra precaution. Sir, we've run out of time, but I'd like to speak to you again sometime this week or possibly next week. Thank you for your time, and please take care, Dr. Norberto Francisco, ang spokesperson ng Lung Center of the Philippines. Thank you, sir.
Thank you also.
And thank you for joining us here on The Source. I'm Pinky Webb. You're watching CNN Philippines.